Good evening, everyone. Welcome to Excel webinar series 2022. As the faculty has some network issue, the section will start soon.
Hello, everybody. Am I audible?
Yes.
Okay. Sorry for the delay. The network issues are quite prominent here. Okay. Should we start, Dr. Deepu?
We can start now, yeah?
Okay,
Yes, sir.
So, good evening, everybody. Today we are going to see the
Just a moment, sir. Just a
Can I
moment, sir.
share my screen? You are talking something, or should I start now?
Just wait, sir. 1 minute.
Okay.
Dr. Uma, you may start.
Okay. Good evening, everyone. Myself, Dr. Umedhar. Welcome you all to the Access 2022 fifth series of webinar with the topic of homeopathy management of Gallstone Colic, hosted by IHI's MA Kerala, collaborate with other science academies. Before starting the series, let us gratitude to our master handyman. Now, let me introduce tonight's speaker, Dr. Kitira Becker, MD Pediatric Homeopathy Academic Coordinator at Parana with other science academies. Doctor has PG diploma in science and adolescent psychology and also MA psychology. He has course. Doctor has in homeopathy, ML, the Wall Institute. He has been doing
Okay, you may start. You may start now. Yeah.
Okay. Can you just give me the controls? I want to share my screen.
Yeah, you can share this.
So, is everybody able to see the screen?
Yes, yes.
Okay. Good. So today we are going to see the Gallstone colic management. Thank you, Dr. Deepu, and thank you, Dr. Ume. I don't know where exactly. Okay, so today we are going to start with one case directly. I'll be more happy if we can interact, and if you have any suggestion, just talk with me in between also. So this is a case of a 34-year female. I took this case on 16th of February in 2019. Her wife is my patient for the psoriasis, and he called me on that day and said that his wife is suffering with the severe pain, severe colic since morning only. Around 5-6 o'clock, the colic started, and the patient and her husband went to the hospital. The hospital nearby, they gave them some painkillers and all. They did USG also, which is suggestive of gallstones. They gave some painkillers, but the pain was not subsiding. They asked them to wait and wait and watch for the some part of time, and then they will say, okay, if the pain subsides, then we will see what to do next. But the pain was so severe, so intense, and the pain was so agonizing that she is unable to stay there only. So, and what type of pain? The pain is coming every time it is in an episodic nature. It comes very suddenly. It started gradually, then it becomes very sudden, then very intense. And after some period of time, then it will again subside. So she waited there, but the pain did not subside. Then the doctor suggests them that you should we should go for the surgery. But she didn't want to go for the surgery. So till that time, it was around 10-11 o'clock, but they decided to take a second opinion. They went to another hospital. And then there also they know that the patient took some painkillers, but the pain is not reducing. They also gave some treatment for some time, and says ki if the pain is not subsided, then we have to go for the surgery only. So patient says, okay, I'll wait and watch. So till that time, it is around 1 o'clock. But the pain is not subsided at all, irrespective of they are staying for their 2 to 3 hours. Then around evening, 4 or 5 o'clock, her husband called me and says that, doctor, can you do something? Can homeopathy do something for this patient? She haven't ate anything since the morning. So I asked them what. Then I take some details on the phone, and she said he said ki wife is not so pro for the homeopathy. She don't want to take homeopathy right now. Also, she don't even believe that the homeopathy can help me. But I believe on you, so please do something. If you are saying that, I can bring her to you. Then I said, anyways, you don't want to go for the surgery, then you can bring her. We will see what we can do. Am I audible properly?
Yes,
Hello?
doctor. Audible.
Okay. Do you understand what is going on? Everybody is with me only? Hello? Okay. So what next? Then the patient come to the clinic. Usually you took such cases. Have you seen any such cases in your OPD? Anyone? Hello? Hello? Anyone is interested to share some experiences like this? Okay, nobody is there, I think. So we'll go ahead. Then I asked her to come at OPD. Why this is not going ahead? Then she told me that the pain was since morning only. It is coming in intermittently. It is gradually increasing since the morning and the pain is not subsiding at all. She is sitting like this in the, can you see me? Hello, can you see me? She is sitting like this. There is a bench in my clinic and she is sitting like this on one corner. And she's like this only. Doctor, uh, okay. So I asked her what happened. Can you tell me, sir, what happened since the beginning? Just tell me about the history. Then husband and the patient both give me the history. That patient says that 2 weeks back she was having intense heel pain. The heel pain was so severe that she cannot even walk. So she took some allopathic treatment for that. The heel pain subsided, but after that she started with the gases and bloating. And suddenly, since yesterday morning, the pain started in the right hypochondriac region, and and what she says ki I cannot eat anything. If I eat a slightest food, then my pain started increasing. Since morning, I haven't eaten anything. Even if I drink a bit of water, then also it significantly increases. So I'm just totally don't want to eat or drink anything. Then I ask, tell me about what happens when eating. And she says, yes, when I eat that time immediately, as soon as I eat, the pain started here. And it is severe pain and it's lasts long even after that. If I eat after that also the pain remains there only. I also feel like vomiting. Now also I feel like vomiting. Then I ask, tell me more about it. Then she says, since morning I vomited twice. And the vomitus is of a bitter character. Whenever she vomits, there is a very bitter taste in her mouth. She was very restless in whole that. Even in 5 to 10 minutes only, she was very restless. Continuously, she is doing like this, like this, like this, like this, like this. Okay. Then I ask her, what are you doing? And she says, I just feel little better if I do something like this. Then I ask, what you do? Can you see me? Hello?
Yes, sir.
Then she is quite restless and she says, I'm just little better. Then she just went for some time. Then she again becomes like this. And then again she's doing like this only. Then I ask about the pain. What makes it worse or better? What are the modalities of the pain? She says, after passing the stool, when I was in the hospital, I just passed stool. Then after that, I feel a bit of a little better for some time. And I also feel better if I lie on my abdomen. Okay, so what do you do then? Then I asked, is it because of the pressure? She says not exactly the pressure, but if I lie down like this on my abdomen, then I felt little better. It doesn't subside totally, but at least I could sleep. Otherwise, I could not. Then I asked the patient and her husband, have you tried to apply some hot or cold fomentation? They said nothing. We didn't apply anything. She says, what about the thirst, thermals, and rest of the physical symptoms? Then patient says, I am thirsty but unable to drink because of my pain. I feel thirsty, but I could not drink because and the taste is also very bitter. So I don't like to. At this scenario also, she is quite hot. Her tongue was thin, white coated and moist. But this is the overall scenario. Any suggestions for this? Or do you want any information, extra information? Hello? Any suggestions for this remedy in the chat? You can write down in chat box. Okay, chelidonium, very good. Any other? Phosphorus, very good. Cardus miraticum, nitrum salt, bryonia, very good. Even arsenic album. Okay. And lycopodium. Okay. What is the most significant and peculiar symptom of the whole case? Can anybody narrate that? If you can find out, we truly not focusing on the medicines. We are focusing on the process. If you understand the process, you can definitely cure any damn patient. Okay, restlessness pain from is a very good symptom. Tongue white coated. Moist. Okay. Water cannot drink but thirsty. Pain after heel pain suppressed. Okay. Can we take that right now? And how can we take that in a repertorial language or mathematical language? This is quite a good suggestion, restlessness. Can you describe little more about it? Bitter taste after vomiting. Okay. Okay, we'll go a bit of ahead. Many good suggestions are coming, like ailment from suppressed heel pain or bitter taste of vomiting. But I want you to see or something which you haven't heard till date, or which is very peculiar to that particular scenario. Okay, then hello, this is not good. Okay, pain gradually increasing and decreasing, the intermittent pain. Then if I eat increases, eating or slightest drinking, the pain is very significant. Then the bitter taste, that is also very important. But the most important thing in this case, the way of restlessness. She's restless, not like that. She's not roaming here and there. But what she's doing just like this. I just like this. She's just pressing and then again just like this. Do you understand this? Okay. So whenever she is doing like this, and we clarified, is it a lying down abdomen or holding together or something like that? Then we'll go with the symptoms, which are very important for us. Then what symptoms I took on that day? What happens usually when the patient comes, when the patient narrates, that time only I start repertorizing. So what were the symptoms? The liver region, gallbladder, bile duct. We need to cover the medicine which is having pathophysiological sphere of action. Then vomiting bile, vomiting bitter, pain, stool amelioration, pain in the liver region, and which is better by amelioration. Lying amelioration. Then Gallstone colic, better by rubbing. And that is a typical, only two remedies are there. Abdomen pain, liver region, Gallstone colic, and better by rubbing. Then abdominal pain, eating while, even eating after, and abdominal pain, liver region is specific when there is no whole abdominal pain. The pain in the liver at the liver region, pain in the abdomen in the liver region while eating only. At the time of eating only, it is really painful for the patient. And then the drinking aggravation, an intermittent type of pain. When we consider everything, we come to the group of remedies. Okay, so how many few remedies which are coming very prominently? Colocin, podophyllum, Bryannia, and Nux vomica. The repertory I use is the MAC repertory. The repertory I use is the MAC repertory. Any other questions? I'm just having. Okay. Suppressed rheumatism, we cannot say immediately right now. Ailments from suppressed agonizing pain, bending forward. We cannot take this rubric bending forward only because she is not continuous forward only. She is again come back to her normal rate, then again do this, and then again come to the normal thing. And then again she becomes restless, and then she rubs, and then again she is in that zone only. Pain better by rubbing on right hypochondria. Very good. Someone have Dr. Prachi. During after eating, restlessness, Colocin and okay. Any other suggestions? Now, can we find out the exact remedy? Now, is it easy for us? Bryannia. Okay, any other suggestions for after repertorization? Okay. So we'll try to find out what is the exact remedy. There are the patient is towards hot, definitely hot. So we think of more of a we consider 4 or 5 remedies. First, the Colocin, which is very peculiar, that bending double, it makes sense. Then when you make hard pressure, very hard pressure, they sit like this only, you know? They don't even move here and there. They are very so much pain that even if you move a little bit, then there is a intense pain. And then the suggestion called as a Bryannia. Podophyllum. Podophyllum, what we see that very good action on the liver as well. Intermittent type of pain. It covers everything. There are 2 specific rubrics which are covered by the podophyllum. That is, one is better by rubbing. And the second symptom which is peculiar to podophyllum is abdominal pain, liver region eating aggravation. So these 2 remedies have very rubrics have less number of remedies, but they are very peculiar. Again, we'll go with the Bryannia. It is right-sided remedy, thirsty, bitterness, everything is there, but it doesn't cover the better by rubbing sensation specifically. Now we go to the family aspect. When we differentiate now, what we do, do you know podophyllum comes to the which family? And Colocin and Bryannia comes to which family? Okay, I'll just tell you. The podophyllum comes to the family of Berberissae. We know now Berberis vulgaris and everything. So, which is well known for the renal calculi. We know that. So, podophyllum comes from the family of Berberissae. It is again from the typhoid miasm. If you know the Sankaran-Sir's miasm, then you know that the podophyllum comes from the typhoid miasm. Then there are 2 remedies. Out of 4 remedies, first 4 remedies, 3 medicines come from the typhoid miasm. Then there is Colocin, Bryannia. Both of these remedies comes from the violence. It is an intense, severe, agonizing pain. But what happens in Colocin? It is better by bending double. In Bryannia, it is better by pressure, and in podophyllum, it is better by rubbing. So when we go ahead with this, and Nux is again from the Loganiaceae family. But the next, what we do not have to consider what happens 2 weeks back. Please understand, when we consider the acute medicines or acute cases, we have to think in a very precise manner. We cannot say that something happens 2 weeks back and because of that today she is having this or abdominal colic. So usually for acute, you should not consider anything ailments from more than 24 to 48 hours. That more than that you should not consider. Then when we again the next is the chili remedy. So what we prescribe, podophyllum. Do you understand this prescription? Any issues, any queries? So on that day, I prescribe podophyllum 200 for every 15 minutes. There is another cabin in my clinic. So I ask patient to lie down in the second cabin and wait for an hour or two. If the pains is still intense, then we have to see what we can do. As the closest remedy, I gave Colocin 1M as a backup to the patient nearby only. So the patient is lying down in the next room, and after till that time I am watching other patients. Then after what time? After some time, what happened? She feels little better. That now there is not as such much of pain. Then I'll then at least 20-30% it is reduced. Then I ask them to go home. If something still persistent, then we will see on the next day. After around 7-7:30, they left for their home, and then next morning they again called me. Now the pain, no severe episode till now, because there was intermittent episode which was very intense, but now there was no severe episode. No, yesterday there was once vomiting, but overall she was in a better state. She can manage the things. The things are bearable for her. They left that hospital saying that tomorrow morning we will come for the surgery. But then now they are asking, should we go for that? Then I said, no, we can wait for a day or two. Then we will see if the things are not under control, or if the things are relapsing, then we may think whether we should go or not. So I prescribed on that day podophyllum 1M every 3 hourly along with the MACFAS 6X. Then on the next day, on 18, she again called me that no episode of abdominal pain. Now the pain is not at all there. The vomiting is also settled. She is much better. She can eat well, slept well also. I asked to continue for that day and then asked for come for the constitutional prescription on a later few days. So this patient write a wonderful review for our clinic that Anandi Clinic is one of the best place. I was in unbearable gallbladder stone pain, and almost all allopathy doctors suggest me to go for the surgical removal of the gallbladder itself for the stone problem. In my first visit also, only my pain come under control, and slowly the stones in gallbladder vanished within few months. So this was a wonderful follow-up which we can get from the patient. But it is around 2 years back now. And we can, as a homeopath, we can help her in a much better extent. That patient referred me many patients till date, just because we can help her in her acute, severe acute condition. Again, her faith towards homeopathy is significantly, now she is totally a homeopathic person. Initially, she was very dicey that should I go for or not. But now she is again very pro for homeopathy, and she is telling other patients also that you must go for the homeopathic treatment only. So this was the case. Any queries? Hello, you can jot down in chat box. Hello, everyone. Should we move to the next one? Okay. It was not Colocin. It was Podophyllum. No, I haven't used riboflavin or anything like that. So yes, patient is totally cured. That's why she wrote for us. She's coming for her help all nowadays. Otherwise, she was quite better. On and off acutes, if any come, she used to come. Okay, we'll go with the next case. Okay. So this is a case of a 34-year male. This case defined on the 24/11/2020. When the patient came, he was having 2 sonography reports. One was for February 2020, and another again he repeated the sonography in the April month. So the sonography report says that gallbladder is thickened. Can you see this report? Gallbladder thickened, and the ecogenic mobile calculus noted at the neck of CBD of size of 7 to 8 mm. Then this was the second report where the size of the calculus is slightly increased in the 4th month, April 2020. Now, when this patient came to me, he was not in a very acute phase. He just having the complaint since many years, and then so we took a full case and then we prescribed to this patient. So this patient is having, he said that I'm having stomach troubles or gastrointestinal troubles since long back. It is at least 15-20 years. Since 1999, I'm having these sort of stomach issues. But since 5-6 years, it started increasing. In last 1 or 2 years, it is very high. It increase nowadays. So I need to vomit every day. Whatsoever I eat, I need to put finger and I just regurgitate. I just need to vomit it out. If I didn't do that, if I don't do this, then I feel like my stomach is going to burst out. It is totally bloated. And there is intense pain. So then I asked about what you eat. Then he said, even if previously it happened that if I used to eat spicy things, then I get vomited. But nowadays what happens, though I haven't took spicy things or acidic things, then even if I eat normal food, then also I have to vomit only. I have to regurgitate only. Unless and until that, I can't do anything. In last 2 to 3 years, I lost near about 9 to 10 kgs. And again, now I'm gaining a bit of weight since last few days, but still I'm not that comfortable. Around 3 years back, someone he did USG that time also, but we don't have reports at that time. They also advised them surgery for the Gallstone colic. Again, when the symptoms are very severe, then again after some part of time, May 2020 means that time also he planned a surgery, but due to the COVID surge, he could not. the physician or the gastroenterologist cancelled the appointment and said that we can't do anything for right now. We'll see after some time when the things will settle. He said it was so intense pain and intense suffering for me that I could not eat freely. I have to eat something in a very normal manner. I cannot go outside and eat whatever I want to, just like any other person who wants to go out and take a vada pav or take a misal pav or something like that. But I cannot drink that. I cannot eat that. And there are episodes which are very severe. These episodes usually comes once in a two months. Even if I don't eat anything outside, then also this happens. What happened in those episodes? That I have intense pain, and the pain is so severe that he is just rolling here and there in his house when the pain comes, and the pain lasted for 2 to 3 months. The approximately 1 year back, the pain was these episodes were very frequent, very frequent. Once in a 4-5 days, once in a week, he used to have that sort of episodes. But recent 6 to 8 months, the intense episodes are reduced. Though he is having that daily vomiting or daily regurgitation, that sort of thing, but the intense episode which used to be very frequent, they are right now quite less. So he said, I cannot eat or drink at that time. If I eat a bit, then also it will surely come out, especially when there is a pain, intense pain. He just roll here and there, can't think of anything. He's very restless at that time. Feels as if I should bang my head to something, or I should hit something. I should hit something like this. Then, but I can't even think of anything at that time. I'm very restless, and it was agonizing pain. Agonizing pain. You can't even bear anything. And I asked, tell me more about your pain. He said, when it is more, when it is less, we usually ask modalities, no? Then I asked, what about your pain? Tell me the modalities which are increasing or reducing, the factors which are increasing or reducing. Now he's running a medical. He said whenever mostly it is in the evening around 6 o'clock. It started at that time, and it is again in days around 9 to 10 p.m. and then again it reduces by 11 or 12 o'clock. Whenever it happens, mostly this happens in this evening time only. Okay, so what else? Then I have to take Dynapur, and there is no one Dynapur or Buscopan is not sufficient for him. Once he took that Dynapur, then again after 1 to 2 hours, it is the intensity remains same. Again he took the second dose again, and then the pain is started subsiding. Till that time, it is really difficult to bear that pain. His brother is M-Farm. His sister-in-law is a GNM nurse. So in this family, he used to, the family is from the sort of having medical background. So they know how to handle the things. But the pain he is talking about, it is really unbearable pain he is talking about. Then there is, he said, the pain is not better if I don't pass the gas. If I can pass the gas, then I feel little better. Now the severe pain especially increase sometimes if I am fasting. Oh, sorry, that fasting is amylation is there. Fasting aeration is written there, but he feels better if the stomach is empty. But he is having very severe aggression if he eats something spicy, oily, something misal pav, or something like leafy vegetables, even palak sabzi, even kanda path, something like that. He is having severe pain episodes. Then I also said what happened at that time. He feel that the pain was so agonizing and everything is so intense that my hands and feet become cold at that time. They just need to be rubbed, or they just need to be rubbed so that I feel better. Okay, so about the vomiting, daily vomiting, what he says, whenever he vomited out, I took time to understand this, why this person is vomiting every time. Then he said, no, I have to do vomiting after each meal, in the morning also, afternoon also, and the night also. Whenever I eat, I need to regurgitate, I need to make it out at least 20-30%, 30% to aana hai, 30-40-50%. I need to take it out. Unless and until I take out, I cannot sustain. So he said whenever it is in the morning, there was a bitter vomiting. Initially, it was quite sticky. But the later part, if he eats something in the afternoon and evening, the vomiting, the bitterness is not so prominent, but it becomes later watery and bland sort of vomiting. So this is overall the major presenting complaint we have with the gallstone. Then there are many associated complaints like his HB is persistently low, he's having sciatic pain, he's having coryza also, he's having chronic constipation issues since many years. Most of the times his stool is unsatisfactory, he needs to strain a lot. Many times he took Ayurvedic treatment for that, and also took laxatives. Also means at least 2 to 3 times a week he needs to take some or the other medicine, then only he can pass the stools. In the morning he needs to go for the stool, and before that he must take tea, otherwise the stool is not passing. It is more of a psychological also, because it is his habit. So these are more of his presenting complaints. Now when I took the case, there are many issues coming from this person's life. Are you with me till now? Hello?
Yes, sir.
Okay. So overall, he is more of an irritable personality. He's quite stocky, robust type of person. He did his metallurgy course and used to go for the job in the Bosri, which is nearby Pune area, but quite far, from around 20-25 kilometers from here. He was quite a man of position there. All the laborers and were scared of him. No one can be late if he is there. Even his manager is also on the guard if he is with him or having some issues. He used to solve the quarrels, and he used to make the quarrels as a person when he was in that particular supervisor area, when he used to be there. Now what happens, he says, I was quite angry, and whenever I am angry, I become very hyper. I cannot control myself at that particular time, and I cannot listen what some front person is saying. I just feel that I just try to prove my point, how I am right only. And this happens, or what happens, he just throw the things, whatever comes in his hand, and just what he just throw and run away from, or go away from that particular place. Not run away. But what happened after that, after his graduation, after his job, he had an accident. And then what happened? He had a fracture on his shin bone, and he need to stay at bedridden for around 1.5 to 2 months. But now his family asked him to don't go for the particular job which is very far from here, and you are also not very comfortable with that, so you must leave the job, do whatever you want to do, do job in Pune only, but what happens in Bosri only there is a MIDC area. So what type of his profile he need to go there only, because in city area there is no such job. So around for 3 years he is at home only and not doing anything substantially. He's doing here and there, but after some part of time, as his brother is M-Farm, he they bought a shop on a rent and started one medical initially. Now he's running his medical on the now he's running his medical on his brother's name. There was a lot of struggle. He talked lot about that particular say how I started, how I worked hard, how I did this and that, how I set up a new sector, because he's from a very different sector and now he land up into the medical sector. How he manages the things, how he and he talked quite a lot about that particular thing. Then whenever he started his medical, there was a, because it is not in a very crowded area, he started slowly. Then after some time he make a joint venture with the diabetologist, and now he's growing quite well in recent few years. But he said, I worked very hard. Many a times I close my clinic at 12 o'clock, 1 o'clock, and if his home is very nearby to that medical. So even if someone wants to 1 o'clock, 2 o'clock, I just wake up and go to there and give the medicine, even if it costs for 10 rupees, 20 rupees. But now I'm doing quite well, and there are things also. He many times he misses his foods. He's quite hasty in food, taking food also. Now he's having dreams. He don't have many of dreams, and he told me that he don't have many of the dreams and not remember as such. On the other side, he's very jolly sort of personality. He's always making you laugh. When you sit there, you will never get bored as such, truly speaking, with him. You have a good conversation. He will do some or the other joke. It is not very intellectual one, but not exactly intellectual, not sarcastic one, but he will make fun of the things and he will enjoy with you. So that sort of feel I get when I talk with the patient. So this is more of a his. There is a long case, but I am narrating the main points for us so that we can go a little faster. Now in physical generals, he used to take 2 liter during day and night, a bit more. Stool, urine once per day, but not very satisfactory. We have seen that in our chief complaints. He liked to eat sweet South Indian quite a lot. He likes sweet and sour taste in combination. He likes fish. He's not at all liking the curd and the tomato. He said, I don't like raw tomato. I like in sabzi form. Then he is having intense aggravation if he eats anything spicy, oily, or even if the leafy vegetables. Then he cannot tolerate hunger so easily. If I got late for half an hour to 1 hour, then I become irritable. Sweat, nothing specific. Scalp, sexual, nothing, any symptomatology. Sleep is okay. Sleeps on abdomen only. That is another symptom which he told me, that I used to sleep in abdomen since my childhood. And I'm a deep sleeper. I don't get easily wake up. I need to push hard so that I can get up, and he is definitely a hot patient. So these are the overall of a person's makeup. Any information now, any suggestions now how to go ahead with this case? The group is quite good, interactive. I'm happy that you are sharing your views. I'm opening my chat box. Any suggestion on this particular scenario? Hello. Yes, you unmute yourself and just talk. No issues with that. Or you can type in chat box. I'm seeing chat box. I'm on the. Hello. Any suggestions? Last time to kitna suggestion diya? You gave not many suggestions on acutes. Okay, now okay, Naxvomica, arsenic album, good. Pulsatilla, again Naxvomica. Good, Naxvomica. Now I want you to focus on the symptom which are very, very prominent in this case. What are the PQRS symptoms? What are the PQRS symptoms? Mix, vomica, and phosphorus. Okay. What are the peculiar symptoms? I want you to just speak on that because that is where we are focusing on. Telling a medicine is a different part. It is really good that you are telling me medicine, but it is important how you reach that particular medicine. That is really important for me. Okay, sleeping on abdomen is one thing. Medorinum, a very good suggestion. Medorinum is a very good suggestion because sleeping on abdomen and especially desire for sweet and sour, one of the important remedies. No? Khatta mitha pasand hai, the things like pani puri and all, typical of Medorinum. Hunger intolerable, hot patient, boasting sulfur. Good. Sulfur is also joyful person, desire aversion. Lycopodium, very good. Joyful person, desire aversions. Okay. So what is the most peculiar symptom which you haven't heard till date in this case? We should start from there. I want you to narrate those PQRS symptoms. What is most important in this case? Okay, sweet. Misses food often. Okay. May I know most of you are general practitioners or most of you are homeopaths? Dr. Deepu or Dr. Ume? May I just bit of know?
You can continue. Okay.
No, I am continuing. I am just asking whether the participants are more of a general practitioner or they are a homeopathic practitioners.
They are a mixed kind of. Okay.
Okay. Okay. Good. No issues with that. Okay. We'll go a little bit of ahead. There were many good suggestions. Then I'll tell you how I process the case. Usually what happens when I took the symptomatology, I divided into three major parts. One is the mentals, then second one is the physical journals, and then third one is the characteristic particulars. So I try to repertorize the mentals in one sector, I try to repertorize in physicals one sector, and I try to repertorize in characteristic particulars in one sector. So what we'll see what we can get after this. Can you see this repertorization? So in mental symptoms, what is very peculiar? Throwing things away around, or anger throwing things with. Restlessness, nervousness, pain during, lot of talk of business about, and the jesting. He's making fun of the things, he's talking with you, sort of thatta maskari jisko bolte hain, means there is a cool environment and you are making fun of anything, he is also enjoying, you are also enjoying, that sort of thing. So what are the prominent remedies coming in our hand? Arsenic, opium, stramonium, Staphysagra, Bryonia, Colocynth, Aconite, Chamomilla, Coffea. These are a group of remedies which we have. We are not going to stamp immediately what we have to give. We have to just be in a group. Then we repertorize the physical generals. So what are the things? The spices and condiments aggravation. Then the green vegetable aggravation. This is very peculiar in this case. You must remember that is fighting the PQRS. How many, usually the gastric symptoms aggravated by acidity and acidic foods or spicy foods is very common. But how many times have we heard that a gastric pain which is significantly increased by the green vegetables? And the this rubric is having hardly 20 remedies, not very big rubric, not very small also, not ऐसे भी नहीं कि 2-3 remedies है. This remedy is having, this rubric is very important for us when we select a medicine, because the gastric complaints, have you heard this symptom till date, that the gastric symptoms, it's aggravated by eating green leafy vegetables, but patient told that. Then there is desire for fish, aversion to yogurt, but it is very small rubric, hardly 4 remedies are there. Then desire for sweet and sour and sleep position on abdomen. Then again, what type of group we get? Medullinium, natrum salt, sulfur, Bryonia, sepia, calcarea, phosphorus, lyco, onto, tubi, arsenic, stannum, and more. The list is going on. But one of you have said the medullinium. Medullinium is also covering coffee. Medullinium is also covering important symptoms of that particular physical generals. Then we will go to the particulars. Just remember the group of the remedies. Now we have to first cover the sphere of action. So usually I took a few general rubrics. I told you that when I repertorize, I usually repertorize at the time of case taking only. So that's why what happens, I understand the general sphere of action of the remedies we try to address, as well as we try to address our case taking is also quite improved, because when we ask a particular question and when you have the options, multiple options in front of you in repertory, then you can have a much better questions with you, when you are equipped with much better questions. But it is also important to keep watch with the patient as well. So what are the major symptoms? The Gallstone colic, abdominal distension better by flatus. Then pain. He narrated that the pain is like some kamata, means it is like electric like pain, lightning, like that sort of pain he is having when there is a severe episode particularly. Then restlessness, physical pain during, vomiting, drinking after, or vomiting, drinking even after smallest quantity. Even if we drink few sips or few sips of water or some bit of water, then also he needs to vomit it out, especially in the acute episodes. Then there is a stomach pain, which is better after vomiting. Then generalities pain, better after vomiting, and there is a chronic constipation. Now we have another group which covers the characteristic particulars. So one suggestion is phosphorus. Now we have arsenic, bryonia, sepia, nux, calcarea, plumbum, silica, lycos, sulfur, veratrum, opium. Now, do you want to comment on this case, or do you have any suggestions? Now we can talk again. Now you have the data which I took for our repertorization, which are there are many of they are not all the characteristic symptom, but it should be processed in your mind that these are the characteristic symptoms which have to be focused irrespective of the hierarchy. Usually we do evaluation and then only we prescribe, but in this case, as there was most of the instant things we have put, so that's why we have to understand that you have to understand what is the hierarchy, what are the most important symptoms of that particular case. Good. Harinath, Dr. Harinath says bryonia. Very good. Later medorinum. Okay, any other suggestions? Okay, so we'll take a full group now. Now we have the symptom, when we connected all the symptoms in one sector, all mental symptoms, all physical generals, and all characteristic particulars. Now we combine them, and now we see what are the main characteristic symptoms we can see, and what are the important modalities it is covered by, what are the PQRS symptoms covered by the particular medicine, and then we can prescribe our medicine accordingly. So any suggestions right now? So very well said by Dr. Harinath. I prescribe this patient bryonia because bryonia covers his mental state, which is of a irritable nature, his workaholic nature. He is working a lot about this particular business, and he is there is a jesting. I really don't want to miss those rubrics which are very short, which are not because of the understanding, but which are very prominent. They are very obvious. For example, in last case, how we have seen that the rubbing is really important in that case, and we differentiated rubbing, heart pressure, very hard pressure, or bending double, and then we prescribe podophyllum, and we can exactly crack the case. Because in acutes, what happened, we have to be very precise, and we have very less time. At least in chronics we have time, we can go a bit here and there, but in acutes you must be very precise, and you should not miss what are the observations, or what are very prominent observations, truly speaking. So in this case, I prescribe bryonia. There are other remedy which is very coming close to this is colocin, truly speaking, because the colocin is having that anger, that throwing things away, restlessness. Again, this is covering the lying on abdomen region. Then gallstone, it is also having a good action on the gallstone and all. Also, there are type of pain. The sensation of pain are covered by the colocin as well. But what bryonia covers is typically a mental state and the physical generals, where the leafy vegetable aggravation. So it is a remedy which is having 3 marks in that particular section. Again, most of the physical generals are covered by the bryonia along with the characteristic particulars. So that's why I chose to give bryonia in this case. So I prescribe bryonia on 24/11/20 for a month. Then after a month, there was a bit of improvement. He said, okay, I am little bit okay. Initially, it used to become directly, but now I can sustain Now I can have a bit of, but at 10-20% I am having relief. So I continued the Brainia. Then Brainia try 200 thrice a day. But again on 13th of January, he came that not so better. And the complaints are starting again. Then I said, Brainia, I gave Brainia 1 ml weekly. On 25th of Jan, 2021, no any change. And so all the symptoms recurred. So on that day, I prescribed Colocin 200 because that was my backup medicine at that time. But unfortunately, even Colocin didn't work. So on 6th of February, in last 3 months, we don't have any sort of, we were not able to give any sort of relief to our patient. Now what? Then I decided, now what? Because sometimes the cure is not very straight. We have to go like this zigzag motion, or we have to find out the best possible medicine, and we should go ahead with that and then try to find the next best possible medicine. But we are unable to do anything for this patient in last 3 months, 2 to 3 months. Then I decided to revisit the case, review the case. Then I have a different cabin, so I asked my 2 students to go there and review this case and just see what the data you can elicit, then come back to me. So on 6th of February, the students took the case and they come to me with the data they elicited. They said that the case was quite good. He makes jokes on situations. He's a jolly good personality, but on the same time he is irritable as well. If the things are not happened, or if his wife is not working according, he gets easily irritable also. Then they took a history in childhood. So he said as a child he was quite a bossy, used to quarrels with the as a child, not so frequently, but he used to quarrel. Then they asked them to narrate incidents when he had a quarrel. He said once the person who was in a once he was in a around 7th, 8th standard, and the boy is in a 10th standard. So that boy bullied him. So he was quite suppressed with that, quite uncomfortable with that. And then he took his friends after the everything school was over, and he beats that fellow. These four or five people go there and again beat that fellow, that why do you did this and that. Also, as his childhood, his father was very strict. He's scared of his father. He used to be very strong personality, and the patient is quite scared of the examination. So he said, what if I fail? How can I perform? He's quite nervous before examinations. And now he is running the medical in the name of brother. So these were the some present scenario which symptoms which he gave on that particular day. So now again there was not much change in the physical generals. Stool, urine, flatulence, desire, aversions, spicy aggravation, hot patient, sleeps on abdomen, and the dreams he told at the time that I have a backlog in exams and I have to clear that sort of dreams he narrated. And now I again re-repertorized the case on that day. That mind jesting, mind fear examinations of, mind deceitful sly, because he is running his OPD medical on his brother's name and manipulating everything and doing the running the things quite well right now. His bossy nature, restlessness during pain. Again, the second sector. This is a mental symptom sector. Then the physical generals. Physical generals haven't changed. So we took everything. But now we see what LICO covers. So spicy aggravation. Again, the second symptom, the green leafy vegetables. Though it is for a 1 mark, but LICO still covers that. Then fish desires, it covers. The smaller rubrics it doesn't cover. And lying on abdomen, that also LICO covers, which are very prominent symptoms of our case currently. And again, when I repertorize the particulars very precisely, then I have got some very nice symptoms. For example, we took the gallstone, colic, and abdominal distension, which is better by flatus. But the patient narrated that he is having abdominal pain, which is started at 6 p.m. and which is very intense at 9 p.m. And there are only 9 remedies in that particular rubric, which we didn't, which I missed in earlier prescription. That the 9 p.m. aggravation is also typically covered by the lycopodium and better by vomiting and all. So now when we take a full picture again, then we can see the LICO is covering most of the symptoms and very peculiar symptoms it covers. Jesting, examination, deceitful, green vegetable aggravation, sweet and sour desires, status, and typically a 9 p.m. aggravation for the abdominal pain. That is also covered by the lycopodium. Then what we, I prescribe lycopodium 30 initially. On 6th of February. Then 6th of February, lycopodium 30. Then again 26th of February. Till that in next 3 weeks, he is at least 40% better. Constipation didn't change much, but the vomiting part is quite better. Also, he was having recurrent mouth ulcer. That is also reduced in that particular 3 days. Then on 17th of March, again the things started settling, and over a period of time, I raised the potency of lycopodium 30 to lycopodium 200. But in later part, when we revisited, the lycopodium coming very, very prominently. So till 2nd of August, most of his regurgitation is nearly stopped. Hardly he have to do a regurgitation. Acidity part is also stopped. But only twice he took non-veg, and in little more of a quantity that day only he had some acidity issues. Otherwise, he's quite better. We also asked him to regulate. These are very important points. Second time, I asked him to regulate his diet as well, because he was in a lot of hurry. He's not even bothering about his timings and the quantity of the food. So I asked him to stay cool, stay calm, and take your food at least 20-25 minutes to eat your food, which he used to eat in 5 to 10 minutes earlier. So these are the practical guidelines which are really important. That also help him to relieve his general state of anxiety or general state of unwellness. So then we have got. Then we do a repeat UAG in 9/10/2021. So if you can see properly, then you can see that gallbladder is moderately distended with thin wall. Previously, it used to be thick wall, 5 mm and more than that. And there is no calculus or no sludge is visible. So, and the impression is also no any obvious significant abnormality noted at present scan. So if our remedy is very precise, and if the symptoms are matching very exactly, then we can cure the patient very, very efficiently. In a very short span like that of around not more than 10 to 12 months, we can cover whole. Usually, I have seen many other cases where the gallstone is really took time to get disappear. Though the symptomatology functionality improves very immediately within 3 to 6 months, but it took time to disappear. In this case, with a proper remedy, with a proper sphere of action, with a proper PQRS symptoms, the case is The gallbladder stones are totally vanished within 8 to 10 months of time. So this is overall a second case. Now he is totally off the treatment from the December 2021. Only comes for the acutes or whatever. He's coming for his wife to right now. So this much from my side. Any questions? Then you can ask. Staphylococcus aureus. Staphylococcus aureus, I don't. Staphylococcus aureus is mainly due to a cancer miasm remedy from the, and it is basically from the Ranunculaceae family. So Staphylococcus aureus is not. When we repertorize the most important symptoms, which covers our characteristics, PQRS symptoms. I don't see Staphylococcus aureus nearby also. Also, the way Staphylococcus aureus is very sensitive, and he is very blunting. Immediately he blunts. But along with that, Staphylococcus aureus is not very well known for the bloating, flatulence, better by flatulence. They are more of a sensitive raw nerves. What we say Staphylococcus aureus. Staphylococcus aureus is called as a raw nerves. They are intensely, suddenly they are reacting to the something which is not, and that is also not very intense. The energy which you feel after Lycopodium anger and the energy after the Staphylococcus aureus anger, Staphylococcus aureus is very more of a plant sort of anger. It is not very that violent. They usually, I don't see a Staphylococcus aureus patient which used to go and hit the person who is not listening to him or who is going against to him. They have anger, but more of a verbal nature, more of a withdrawn nature, or they burst out. But physical violence is little less in Staphylococcus aureus. Any other queries? What about Nux and Medorrhinum? Nux I ruled out because of its chilliness initially, and Nux is also important remedy, but it comes from the again Loganaceae family. It is very curt. When we try to understand the responses to responses of a particular person, if a person we know in a Lycopodium that hard to inferiors and soft to superiors. So when a person who is more powerful than him, then he didn't react on spot. He waited, and then he took his 4 or 5 friends along with them, and then he go and then he beat because of his nature. Nux usually don't wait for that much sort of thing. He won't even think. He won't even think that very whether you are big or boss, are you small, big, are you a boss or anything like that. If I am angry, then I'll hit you like anything. So Nux, the pattern of the anger is the shades of the anger are very similar to the Lycopodium in this case. Both are quite fastidious, but the Nux is fastidious for his business and work. Lycopodium is fastidious because he tried to prove his dominance. He is dictatorial. He wants to prove authority in that particular. So that's why he don't like that someone is getting late. So Nux is a very good suggestion. Again, a Medorrhinum. Medorrhinum on the other side is very close remedies, and most of the symptoms are covered by the Medorrhinum, just like the Lycopodium. But Medorrhinum is very hasty on the other side, very docile. They are hasty as well as they are. And the important rubrics which we consider that, for example, leafy vegetable aggravation, and the fish desires are not covered. Fish desire is covered by the medullarium. We might think if in case the medullarium will be needed as a intercurrent if necessary, but in this case we don't need that. Lycopodium is suiting everything from top to bottom, and that's why we can get a wonderful cure within a very short period of time. Any sarcodes or nosodes, I haven't used per se gallstone, but if the myosomes are very prominent, if the case is very psychotic, or if the case is not moving forward, or if the case is stuck in particular part, then I use nosodes, even like Thuja, natrum sulf, even medurinum. Just like in these cases, in case if case is stuck, we might use medurinum. But usually I don't prefer to use unless and until it is really needed. But in stuck cases, we use. Gallbladder stone size, it really not that matter. To a homeopath, it is not an issue of homeopath or allopath. If it is having a size which blocks the thing, which is having, and if you are not able, and the location as well, where exactly it locates. If it is blocked everything and if it is painful, then you have to operate irrespective of its size. Yes, we can use millisimal potency in acute pain, but I mostly try to go ahead with the 1M potencies in a frequent repetition. For example, in first case, I prescribe podophyllum 1M every 3 hourly. So in that case, we can use, but if we are, I'm not very, I haven't used that much in acutes. Rarely I used in acutes. I prefer to give 1M or even 10M also if I prescribe 10M in acute conditions. Any other question? Okay, then we can stop for here. Gallbladder stone with no symptom, what to do? Nothing to be done. Don't do anything, no need to do anything. Many a times what happens, I have seen many sonographies where there is a evidence of gallstones, but patient don't have any symptoms. They are like that only. I prefer not to probe something like that unless and until it really creates any problem. For us, the functionality is the most prime thing. If the function hampers, if the function, then we don't have to do anything unless and until something functionality alters. Whether it might be in your food, it might be in your day-to-day routine. Yes, accidentally find out. Many a times it is find out in the accident. Chances of CA, I really don't have any patients which are I cannot comment more on this particular question because I haven't seen cases of CA. My most of the practice is as I am a MD pediatrician, I have seen day in day out 70 to 80% pediatric cases only. The cases which I have seen in adult cases, they are more of a because of the child's parents and their relatives. They come to me for their this thing, but I hardly see CA cases, so I cannot comment more on this CA part. Okay, now. So this is all from my side.
Yes, yes, sir.
Thank you very much.
We don't have any more questions.
Thank you, Kerala Medical Association, for giving me chance to share my views on gallstone colic.
Yes, yes. Dr. Simi?
This is my email ID and phone number. If you have any questions or queries, you can text me or WhatsApp me. Anything would be fine with me. Thank you, Dr. Deepu.
Yeah. Dr. Simi?
Yeah. Thank you, sir. Thank you so much. Thank you on behalf of IHMA and all the delegates present here. I extend my sincere vote of thanks from the bottom of my heart to today's speaker, Dr. Kridraj Worker. The class was very informative and we are really enlightened with your knowledge. So thank you for spending your valuable time with us. We feel extremely privileged to attend the section with you, sir.
Thank you very much.
Okay. I also extend my gratitude to all of you joined with us today. And thank you for the active participation and making it live. And we have one special announcement. Our two programs are going to come in soon. One is Quest 2022 via our Instagram page. That is our IHMA Kerala official. There will be 3 questions per day and it will be posting from 9 p.m. to 9:30 p.m. And winner will be selected by adding the total marks score. So come and join with us. And we have another program that's a state conference, which is going to be held soon on 15th May 2022 at Ernakulam. That updates will be posting soon. So join us for the conference and knowledge and entertainment. Once again, I thank each and everyone present here. See you all in the next section. Thank you. Good night, everyone.